5 families have to decide which medical professionals to trust when it comes to the COVID vaccine. Connecticut and the federal government disagree on some of their vaccine guidance.
And that can be potentially confusing people who are wondering if they or their kids should be vaccinated. Your reporter Dylan Fearon is live outside the Department of Public Health in Hartford, breaking down this guidance. Dylan.
Well, Aaron, Stephanie, it's not just Connecticut, but Massachusetts, New York, other Democratic-led states changing their guidance, making their recommendations different than the federal government's, different than the CDC's, especially when it comes to children and pregnant women. David and Stacey Garfield are sick of their health being politicized. Democratic-led states are recommending the COVID-19 vaccine for all adults and children over 6 months. The CDC is relaxing COVID vaccine recommendations. The agency just removed pregnant women and children under the age of 2 from their list of patients they recommend get a COVID-19 vaccine. Families now have to decide who to trust.
And it's between the person and their doctor. The doctor should know, who's at risk, who's not at risk, and based on that, make a decision as to who should get, when to get the vaccine.
State leaders are pushing back today, saying pregnant women and children under 2 should receive 1 dose each. Jessica Holzer is an assistant professor and public health program director at the University of New Haven.
The data on vaccines reducing the risk of hospitalization and reducing the risk of severe complications is very clear, especially in the pregnant population.
Connecticut's Department of Public Health says its guidance is based on evidence from experts with 3 medical organizations, including the American Academy of Pediatrics. But conflicting guidance is devastating, according to Holzer.
It's devastating to public health. It's really frustrating to see it become a litmus test for sort of fealty to a specific political belief system. And that's in both directions.
These are just recommendations from the state and federal governments, no mandates, but receiving different guidance along with politicization can become confusing. It can also impact trust and confidence.
If the evidence doesn't support your passion, I would hate to see someone injured or die as a result of that. And that's really what public health is trying to prevent. Regardless of how you come at it, we'd like to keep you alive.
Now, in Connecticut, the state is recommending all children over 6 months and all adults receive a dose of the COVID-19 vaccination. Aaron and Stephanie, the Department of Public Health will have a press conference on their guidance and recommendations tomorrow afternoon. I'm your reporter live in Hartford tonight, Dylan Fearon, Channel 3 Eyewitness News.
Dylan, thank you.